This study is a real world, so it's based on data available from public databases. And the interest in doing this is because a lot of the patients that have IDH1 mutations, because of the time it takes to get the mutation results, if they're unfit for chemotherapy, they start with aza-ven. And we know that aza-ven is a good treatment for patients with IDH1 mutations. So a lot of the information that's been generated for IDH1 inhibitors in general, and that applies to olutasidenib, is in patients that have received other therapies. But because of this sequence that happens, we wanted to see the experience when the patient has already received a good therapy, like ven-based therapy. So we looked at the records of these patients that have been treated in real world, outside of clinical trials, largely in community settings, with olutasidenib after having received treatment with a ven-based combination. What we found is that the results pretty much are the same as for the known experience with olutasidenib, meaning that over 35% of the patients respond. Largely, these are CRs. Actually, these get close to 50%. So what this means is that really the prior exposure to ven doesn't negatively affect the possibility of responding to olutasidenib. Also, the safety profile was similar to what we've seen in other settings. And that gives the sort of comfort to know that if that is a sequence that a patient has to follow, olutasidenib is a valid option. Granted, this is chart review, this is retrospective, but in the absence of prospective data, I think it is valuable for the clinical practice.